All right, so you're looking at trying to go back upstairs normally, as in with both legs, after your knee replacement surgery. You're probably 2-3 weeks out at this point, hopefully. Sometimes it takes a little bit longer, that's not a problem. But here's how we would go about that process, right? So let's say this is my railing, and I have a cane in the other hand, unless I have another railing on each side, in which case, always use a railing. So they're the most stable structures. This is how you're gonna do it. So I'm gonna get my cane up to the next step, hold on to the railing. I'm gonna get my surgical leg up first, and I'm simply just gonna step up like this, right? So I have arm support in both arms to support me. But from here, I'm just gonna use my first step, my first stair that I have available, and I'm going to repeat that. So once I get up here, I'm gonna keep my foot here, and I'm just gonna repeat that process, right? So back and forth like that. Trying to push through that surgical leg as best as I can tolerate, right? This is what's gonna build up that strength to get better at going up the stairs normally. So that way I go here, and then essentially over time I can go right up with my other leg and go foot over foot, right? Now, as you get better, what I recommend, lose the cane, hold on to the railing, up with the surgical leg, and same idea, repeat. Try for about 10 reps. Once you're getting comfortable with that, then you could even try taking away the railing, right? And just doing it with just the left leg. Now, one thing that you might find if you're going to physical therapy is that you start on a lower step than your normal staircase. This is about 4 inches high. A normal stair is probably around 7 inches. You may have shorter, may have higher, but the standard is usually around 7 inches. So if you can get a shorter step, 2, 4, 6 inches to build your way up, if you're having a lot of trouble with this, then you can do that instead of just going straight to your stairs, right? Same idea applies. Use some arm support to start out. Once you get comfortable going up to the shorter step, then you can go to the higher step and getting up to that 7-inch stair as you feel comfortable. I recommend trying to get good at going up the stairs with both legs before you try even going down with both legs at the same time. Reason being, it's naturally safer. You're at the bottom of a staircase going up versus the top going down. And also it takes more load and range of motion going down the stairs with both legs than it does going up. So once you're comfortable with going up like this, then the same idea applies. Grab my cane here, where I'm going to go down with my good leg, right? So I'm gonna go down with my surgical leg, still holding onto the railing and the cane, like so. And I can come back up and repeat that process just like I was doing for the up step, going for about 10 reps, starting on a lower step if I need to, and then working my way up to my standard stairs, right? And eventually I'll take away the cane, just use the railing to get stronger and more comfortable in this movement. Hope that helps. If you have any more questions about your knee replacement surgery, comment them down below.